Oh my God.
Yeah, I woke up so freaking stiff. I've been having like this neck thing.
You're like full on stretching.
Yeah, well, I'm old.
Older than me. Just kidding. You're not old.
All right, ready?
I'm ready.
Okay, cool. Hi, Ollie.
Hey, Danny.
Ollie, when people find out that you offer sex therapy, what are often their first impressions?
So it like took me a minute to try and formulate how to say this because I don't think they associate it with being a licensed therapist. So I
Mm,
think people will kind of giggle or they like ask what it is. I don't think they take it seriously like a legitimate career. And then I think once I tell them I'm like a licensed therapist, then I think they just get confused and they don't quite understand the nature of it and their demeanor kind of changes. And it's like, "Oh, wait a minute. No, that's a real thing. Like what is that?" So that's what I tend to get. What do you get?
no, that's a really good answer. I actually like didn't think about that, but no, I think I often get a very similar thing where most people are like they hear therapist, and I think therapist is like can be anything. They don't
Yeah, which I
really
forget
associate.
also, because when
Yeah.
I say therapist, I clearly know like, I'm biased, but I know exactly what we mean. But I will
Hmm.
have so many people that even if I say, like, "Oh, I'm a therapist," they're like, "A physical therapist and
Hmm.
a massage therapist." I'm like, "Oh, good point. There are a
Yeah.
bajillion different kinds of therapists."
Yeah, yeah. So no, good one. I didn't even think about that. But yeah, that's very true for me as well. Also for me, if I'm not met with shock, I think I'm usually asked if that means that I watch people have sex or if I'm the one having sex with them. Yeah.
You're like, "That is a sex worker."
Very,
Slightly
very
different.
different. When people hear sex therapy, they usually imagine something very, very different from what it actually is. Now, some people find the thought of talking about sex, even to a professional, to be very inappropriate. Some think that it's only for those who experience issues like erectile dysfunction or vaginal pain. And even when people do want to talk about sex, your typical therapist is often just as embarrassed as you are, or they're not actually trained to address your concerns professionally.
Mhm. And so, with that, everyone, welcome back to Freudian Slips. And today, in case you have not picked up on it, we are giving you the inside therapy breakdown of a type of therapy that is often misunderstood: sex therapy. What it is, what it isn't, and who it's actually for.
Sex is an important part of many relationships and identity formation, and yet it's a subject that is one of the least talked about in an open and honest way. Most people don't grow up learning how to communicate about sex. I don't think it's a surprise to anyone when we say that sex education in the US is terrible. And while it's not the focus of today's topic, Ollie, would you like to know a very, very sad truth?
I mean, like, yeah and no, but yeah.
Well, according to a study published in the American Journal of Public Health, only 37% of states require curricula to be medically accurate
Like, wait, across subject?
across sex education.
Oh, yeah, that doesn't surprise me. I thought you just meant in general at first, and I was like, there needs to be no reliability in anything we learn. Oh yeah, sex? No, they can tell us we get pregnant by doing it in the butt.
Yeah. 37%, that's 19 out of 50 states require that if you are giving sex education, that it needs to be medically accurate.
I think it's because fear-based. I think it's because we're still so, like, if it is taught, which a lot of the times, A, it's just straight up not in schools anymore, but
Mhm.
if it is, and also I'm thinking this means in schools, or, like, I'm looking at it from the in schools perspective, but also a lot of them are still abstinence-based.
Sure.
So that would make sense that it's like, why teach what's medically accurate if we're also trying to tell people not to do it, and we're just shaming them about it or trying to, like, use fear to get them not to?
No, no, you're actually onto something. Like you're hitting the nail on the head. So again, if y'all are interested in that conversation, let us know in the comments because that is a very, very interesting conversation. Yeah, right there. So
Yeah.
instead, most of us learn about sex and sexuality through a mix of cultural messaging, media, past experiences, and sometimes shame. So, what we often see in therapy are people who are struggling with things like mixed match desire, difficulty communicating their needs, performance anxiety, or feeling disconnected from themselves and their partners. But due to our culture's stances on sex conversations, people often don't have the language or the space to talk about it. And that is where sex therapy comes in. Now, before we break down what sex therapy is, let's first talk about what sex therapy is not.
Yes. Okay, I love this. So number 1, sex therapists do not have sex or even physically touch their clients. A big misconception is that people often assume sessions involve nudity, demonstrations, or physical interaction. The truth is that sex therapists, like most other therapists, are talk therapists. And believe it or not, we adhere to strict ethical guidelines that prohibit any sexual contact with clients. Fun fact though, there are professionals who do interact with their clients physically called sex surrogates. And comment down below if you'd like us to cover that topic, because that's fun. There's also professional cuddlers.
Really?
Yeah, it's like a thing. Like people cuddle and it's like
Oh,
a
oh, yeah, yeah.
yeah. That's
I
not a therapy, I don't think, but
no,
it's just there are professional cuddlers and they touch people, but we
yeah,
don't.
not us. Yeah, not
Not
us.
us. Our licenses would be gone.
Number 2, sex therapists do not watch people have sex. While some can understand that we don't touch our clients, I still get a fair few people looking to come into therapy in the hopes that I would be able to watch them do something and then give them advice. The truth is that while we might spend a lot of time talking about what you do, we have no intention of watching you do it.
A third thing that sex therapy is not is sex therapy is not just for couples. You may think that you have to be in a relationship to see a sex therapist, but in reality, individuals commonly seek sex therapy for many of the same concerns couples do, just on a more personal scale rather than relational. And Danny, I'd even say I probably see like 50% of the sex therapy clients I see are individuals, and maybe about 50% are couples. But I see a lot of people individually.
Yeah, yeah, same. Which is why I think I've always been really interested in sex therapy or why I've always considered it to be a very important part of my practice. Like it just when you know what to look for or when you know how to talk about it, I think it's just happening all around you and almost anybody can benefit from a good conversation. So
Yeah.
now I'm with you there. Yeah. Number 4, sex therapy is neither conversion therapy nor is it trying to convince everyone to open their relationships and join in one big orgy. Now, for those who don't know, conversion therapy refers to a range of practices that attempt to change a person's sexual orientation or gender identity, typically from the LGBTQ plus community to something that's heterosexual or cisgender. And it's sad to say that we are sometimes approached by people who are bothered by a loved one's sexuality in the hopes that we can correct it. Not only is conversion therapy a discredited and harmful practice, but it's unethical and you won't catch us doing it. On the other end of the spectrum, however, are those who assume that we have no values at all and would happily endorse any kind of sexual behavior. This is an assumption that I've personally experienced, and it's really disappointing to hear. The truth is that while our care does aim to be affirming, it's also rooted in developing the client's values, boundaries, and relational contracts.
Ooh, I love that one. Okay, and then lastly, sex therapy is not just for sex addicts. While we are trained to help those struggling with what we would consider compulsive or out of control sexual behaviors, there is so much more to sex than, well, like the sex itself. And we shouldn't be confused with a certified sex addictions therapist. So, again, let us know if you'd like us to explain the difference in another video.
So, what is sex therapy? Well, at its core, sex therapy is talk therapy that focuses on education, sexual health, values, intimacy, and connection. It's a space to explore the psychological, emotional, and relational aspects of sex.
And as sex therapists, we understand that sex isn't just physical, but a part of the human experience that's deeply tied to identity, attachment, and meaning.
In sex therapy, you might explore beliefs about sex, past experiences or shame, communication patterns, desire differences, and anxiety or avoidance. And often, what we find is that sexual concerns are connected to broader relational dynamics.
For example, if someone struggles with vulnerability, that shows up in intimacy. If there's unresolved conflict, it affects desire. If there's pressure or fear of rejection, it impacts arousal.
In other words, the stressors you're having outside the bedroom are often following you inside the bedroom. For example, we can give you like a little personal take of what shows up in our room.
So, Danny, I know the one I wanted to touch on was religion, because being that I live in California. I've always seen myself being a sex therapist in California. I knew out the gate I was really interested in like kink culture and like polyamory and like kind of the world that sex therapy could be and like all these different things that like are out there when it comes to sex. Like I kind of knew that that's the niche I wanted to get into within like California and the Bay Area specifically where I am. What I found really interesting though is especially which I actually get some of these clients in California as well, but I'm also licensed in the state of Idaho. And when I get clients that come to me for sex therapy that are from Idaho, it's much more about religion. And it's
Mm,
much more about how religion has played a role in their shame or just in how they view sex and intimacy. So, a religious client might seek out sex therapy when they're experiencing tension between their sexual experiences, desires, or relationship dynamics, and the beliefs or values they were raised with. Many individuals from religious backgrounds are taught strict or limited frameworks for understanding sexuality, which can sometimes lead to confusion, shame, anxiety, or difficulty communicating about sex within a relationship. So, sex therapy can provide a respectful, non judgmental space where clients can explore these concerns, clarify their personal values, and develop a healthier, more integrated relationship with their sexuality while honoring the aspects of their faith that remain important to them.
mm,
So, for some clients, the goal is not to move away from their religious beliefs, but to reconcile those beliefs with intimacy, desire, and partnership in a way that feels authentic, consensual, and emotionally fulfilling. So, a sex therapist can help individuals and couples navigate this process with sensitivity to both psychological well being and spiritual identity. And I wanted to point that out because I think a lot of people would think A, they need to see like a religious based therapist to
mm.
do this, where I think it's actually just naturally a very big part of sex therapy type work. And I mean, almost as much as it surprised me, I would just be curious if there are people listening who might resonate with that or like are really religious, have kind of come up against some of these struggles and are like, "Oh, I didn't even like think about sex therapy as a way that I could talk about this or try to work through this in some way." So, I kind of have loved that this is another population I've ended up working quite a lot with, no matter what the religion is. And I kind of love that it's something I was not expecting as being a sex therapist, like primarily based in the Bay Area.
No, I love that one. That one's a really good one.
Yeah,
Yeah. Ooh, great job. I like that one.
thank you. How
Yeah.
about you?
On my side of the fence, I have had the honor of working with a lot of people who have either never had sex before or are in the very early stages of their sexual identity formation. So much of the stressors that these people face are trying to reconcile the messaging that they are consistently bombarded with little to no sex education, media that paints a glorified depiction of what sex should look like, and the social pressures that we should simply know what to do. These people experience a lot of anxiety, fear, and embarrassment in the bedroom, which leads to many having poor or painful experiences, avoiding relationships altogether. In sex therapy, we get to provide the education they need, we get to remove the pressures, we get to rebuild their relationship to pleasure, and we also get to model their sex around their values, which leads to these people entering their sex lives empowered and ready to share themselves rather than having their partner kind of tell them how they should be experiencing themselves. So, sex therapy is really about understanding the context around sex, not just the behavior itself. So,
Mhm.
who is it for? In case you haven't figured it out yet, we believe that sex therapy is for everyone. Sexual health is a part of your general health. And if you're interested in exploring how your sexuality impacts you, your relationships, and how you experience the world, sex therapy is definitely something that you should consider trying.
Mhm. Also, if there's an area that feels uncomfortable or even anxiety provoking, you're probably not alone. Most people were never taught how to talk about sex in a healthy, open way. So, struggling in this area doesn't mean something is wrong with you or your relationship. It often just means that this is a part of life that needs more attention, communication, and care. And I mean, even with that, I'll throw in that even in grad school,
Mm,
talking about some of this stuff or having conversations, like I remember us kind of like earlier, Danny, where you pointed out sex therapists aren't just going to like approve of everything. We had a professor that would make us be like, okay, bestiality, but here's the case. Like the animal was dead. Da 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 da. It's like they threw out some of the craziest scenarios to be like, would you be okay with it? What would you do? Do you think this is ethical? And it's like there were people in like who wanted to be sex therapists that were like, um, do we have to work with that? Like, oh God, I didn't know. Like, it makes everyone uncomfortable until
yeah.
you truly start like getting thrown in and talking about this. Even for sex therapists, at first. There's people that don't know how to talk about certain things or like feel like, oh, I can talk about that a lot easier than I can talk about this.
For
And
sure.
so, yeah, like please, people do not think you're alone because there's also so many sex therapists that probably have some struggle talking about this in their own lives. And it's very different in a work setting than in a personal setting. So you are totally not alone.
Yeah, 100%. So maybe the question isn't just, is something wrong with our sex life? But it also might be, what is our sex life trying to tell us about our relationship? Because intimacy often reflects the deeper emotional patterns between people. Now, if this episode was helpful, consider sharing it with someone who might benefit from it. And if you want more conversations like this around relationships and mental health, please follow, like, share, subscribe wherever you guys are listening. Any closing thoughts,
Yes.
Ollie?
Yes. In the description below, we have linked a beginner's guide to finding the right therapist. So we have a free chart that compares like 30 different types or 36 different types of therapies and who it might be good for. And so whether it's, sex therapy or you're considering any other kind of therapy, feel free to check that out. We also offer like a 30-day, like fun advent calendar style, like reignite your sex life from two sex therapists with all of our like sex therapy homework assignments included that kind of start you off slow and really ease you into the month of having a lot more connected intimacy with your partner. So check some of those out. We'll have links in our description. And we really are just here to provide everyone with information and places to find more if you are interested.
Awesome. Great. I'll see you next week.
See you next week.
Bye.